When receiving Adriamycin 2 mg per milliliter intravenous solution, it's important to follow the instructions provided by your healthcare professional. The dosage will be determined based on your medical condition and body size. If the medication comes into contact with your skin, wash the area immediately with soap and water. If it gets into your eye, flush with water for 15 minutes and seek medical help. Caregivers should take precautions to avoid contact with the patient's urine or body fluids for at least 5 days after treatment. It's also recommended to drink plenty of fluids during treatment to help move the drug through your body and reduce some side effects. Nausea, vomiting, diarrhea, and loss of appetite are common side effects of Adriamycin 2 mg per milliliter intravenous solution. Some people may need drug therapy to prevent or relieve nausea and vomiting. Not eating before treatment may help relieve vomiting. Changes in diet and lifestyle, such as eating small meals and limiting activity, may also help lessen these effects. This medication may give a reddish color to your urine, tears, and sweat, which is a normal effect of the drug and should not be mistaken for blood in your urine. Temporary hair loss may occur, but normal hair growth should return after treatment has ended. Nail changes, including fungal infections, may rarely occur. Remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. However, tell your doctor right away if you experience any serious side effects, such as diarrhea that doesn't stop, symptoms of heart failure, redness/flushing of face, joint pain, or painful sores on the lips, mouth and throat. A serious skin reaction that looks like a severe sunburn may develop on any previously treated area of skin, and the medication may also make you more sensitive to the sun. Limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. Tell your doctor right away if you experience skin redness, pain, swelling, peeling, blisters, or if you get sunburned. In children, a serious skin reaction may occur in the lungs. A very serious allergic reaction is rare, but seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed, contact your doctor or pharmacist. Before using Adriamycin 2 mg per milliliter intravenous solution, it's important to inform your doctor or pharmacist about any allergies you may have or any medical conditions you are currently dealing with. This medication may increase your risk of developing infections or worsen current infections, so it's crucial to avoid contact with anyone who has a contagious illness. It's also important to inform your healthcare professional if you are planning to get any vaccinations while using this medication. In addition, Adriamycin 2 mg per milliliter intravenous solution may have an impact on fertility in both males and females and can harm an unborn baby, so it's important to discuss reliable forms of birth control with your doctor. Breastfeeding is not recommended while using this medication. Furthermore, this medication may affect children differently and may slow their growth before puberty. It's important to discuss the potential side effects and risks with your doctor if this medication is being considered for a child. Overall, it's important to have an open and honest discussion with your doctor about your medical history and any concerns you may have before starting treatment with Adriamycin 2 mg per milliliter intravenous solution. When taking Adriamycin 2 mg per milliliter intravenous solution, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. This includes medications like digoxin, progesterone, streptozicin, stavudine, trastuzumab, and zidovudine. It's also important to be mindful of other medications that can affect the removal of doxorubicin from your body, such as azole antifungals, calcium channel blockers, rifamycins, St. John's wort, and drugs used to treat seizures. Additionally, it's recommended to avoid eating foods or products containing turmeric, curcumin, while taking doxorubicin, as it may decrease the medication's effects. Always keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If you have any concerns or questions, make sure to consult your doctor or pharmacist for more details. If you suspect someone has overdosed on Adriamycin 2 mg per milliliter intravenous solution and they are having serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include seizures and unexplained bleeding. When using Adriamycin 2 mg per milliliter intravenous solution, it is important to undergo lab and/or medical tests to monitor your blood mineral levels, complete blood counts, and heart/liver function. It is crucial to keep all medical and lab appointments and consult with your doctor for more details regarding the use of this medication. Make sure to take each dose of Adriamycin 2 mg per milliliter intravenous solution on time. If you happen to miss a dose, make sure to consult your doctor or pharmacist for a new dosing schedule as soon as possible. Be sure to consult the product instructions and your pharmacist for details on how to store Adriamycin 2 mg per milliliter intravenous solution. It's important to keep all medications out of reach of children and pets. Remember not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.